Swine flu, avian flu, West Nile, SARS. Every few years, we see an illness become a major news story. Now we have coronavirus. There is little question this latest outbreak is newsworthy, but is the media being alarmist or informative?
This week, coverage of coronavirus reached a fever pitch.
The World Health Organization declaring a global emergency.
Some 800 Americans are believed still to be trapped in Wuhan, China.
The State Department late tonight advising against all travel to China.
And news of a special flight of Americans being flown back from China was described in apocalyptic terms.
Nearly 200 Americans now out of the danger zone.
Crews right there waiting, medical teams, in fact, wearing protective gear.
Here in Boston, the local media has staked out Logan Airport, trying to talk to any and all arriving passengers.
Masked travelers from Greece, Austria, Stockholm, all expressing concern.
I'm just trying to be careful. I mean, it's kind of silly not to.
We spotted people disinfecting themselves after arriving from China.
Good grief. Let's put things in perspective.
The World Health Organization said 2% of the people who contracted the virus in China have died.
If that holds, the fatality rate for coronavirus is well below seasonal influenza, which kills thousands of Americans every year. And so far, the number of coronavirus cases here is minuscule.
Health officials in the U.S. say confirmed cases stand at 5.
And those drugstore face masks, health officials say they do very little. So maybe we could hear more advice like this.
The CDC's advice on this could have come straight from your mom. Cover your mouth when you cough, wash your hands often.
A case of media, heal thyself.
Callie, you've been in the medical world. You were a producer for Tim Johnson for years, and we're not minimizing this because this is a real story. It's a real illness. But, 8,600 people, I think, in the United States have died from the flu this year, and we focus on these sort of things that these almost like fad diseases that come up.
Well, we do, but this is not one of those. This is close to being named a pandemic. That's an entirely different level of disease. First of all, the scientists don't know exactly how it's transmitted. They were a couple of weeks late saying, hey, you can do human-to-human contact. The difference with the flu is we know how it gets transmitted. We know there are several strains. One vaccine may not fix every strain, but we know that. There's lots that's unknown about this. And there are deaths in China, and people are traveling. I think it reminded me a little bit of Ebola, except it's not quite. They do have some ways of addressing it.
That was contained.
Well, yes and no. Remember, there were those Americans.
It's still there.
Yeah.
It's still there.
So, and in the end, it came up there. It was because of this vaccine that they were able to pull together toward the end. So I'm not sure that this is unreasonable. I agree with you about the masks. The more you know about how you respond to it is good. Yeah. But I think when scientists start putting the people didn't put themselves on the plane. The scientists said, put them on the plane, let's quarantine, let's see.
And in addition, along those same lines, the media did not lock down, what is it, tens of millions or hundreds of millions of Chinese?
Yes.
The media is not sealing China's border. There's inherently dramatic and frightening stuff happening with this. I'm all for valuable context, reminders about how deadly the flu can be. I think there's value in that. It seems so far, as I understand it, that most of the people who've died from this novel coronavirus are people who've had underlying conditions, people who haven't been well otherwise. I appreciate the sort of basic advice, wash your hands, cover your mouth when you cough. But this is a big, serious thing. Well, I say this without your expertise, but this strikes me as objectively a big deal. And I've seen a lot of, I think, responsible coverage of it.
I think some of it has. I mean, when you use phrases like danger zone that we heard from the NBC reporter, nobody's died in the United States. 240 people, as of last count, have died in China. It is a worldwide World Health Organization emergency. But you mentioned Ebola. I looked it up. There was still an emergency alert in effect for Ebola as of last month. And in the last year and a half, more than 2,200 people around the world have died from
and no
Ebola.
One's talking about that.
And nobody's talking about that. Yeah. So I just think it's one of the problems is it's been widely reported that the World Health Organization only has like a binary system. It's like it's safe or there's a health emergency. And that they should perhaps think about having a tiered level of emergency so to better communicate the actual, like we used to have the terror alert system or something like that with 5 different colors.
That's so
or whatever.
weird. I didn't know that.
I would just remind you that when they don't know, this is where we get to.
Yeah.
So that's where I'm
Exactly.
down. The scientists don't know. So they're erring on the side of let's be careful. That's what's happening. You know.
I'm not going to downplay the seriousness of it. One thing that I think we ought to be watching for is the media's tendency to place an overemphasis on diseases that come from places other than the United States. The Boston Globe has a good story out right now about discrimination
Racial
against
fallout.
Chinese, both in Boston and around the world. We've seen this with SARS from China. We saw this with Zika from Brazil, Ebola, and even early AIDS
That's what I
from
was gonna say.
Africa and
That's right.
Haiti. So let's be careful about that, too.